I'm going to switch from my role as elder to physician to give the community immunity moment, since I have the privilege to be here. But this too is about love. Loving your neighbor as yourself. The second part of that verse in Matthew. Loving your neighbor means doing what you can to avoid exposing them to COVID-19. And right now that means wearing a mask and keeping your distance, physically, although maybe not socially. Soon it will mean getting the vaccine to prevent COVID from getting a foothold in your body, which if left unchecked can cause you to become a spreader of the virus. So here's what you need to know about the vaccine. First, there is no COVID virus in the vaccine at all. It is a man-made copy of a small part of the outer structure or wall of the virus. When this copy is injected into our bodies, our immune system, that part of our bodies that fights off infection, goes into action. Our immune system examines these parts, these copies, and then manufactures antibodies and T cells to attack this copy. Since it is a copy of a part of the virus cannot reproduce or multiply in our bodies, and although it takes a few days to eliminate the copy from our bloodstream, our wise immune system has kept a file at the ready. So if the virus enters our body, it is prepared. Now there is no examination phase. It recognizes and attacks the virus. This attack causes a breach in the wall of the virus, and then the whole immune system can get inside and kill the virus before it can get a toehold in your body. So you don't get sick and you don't become infectious. There's a few things to know about the vaccine. There are 2 vaccines currently available, and they're very similar. Both are over 90% effective, and they both may have some temporary side effects such as aching and fatigue, usually less than 48 hours. But if you get those side effects, that often means that the vaccine is working, that it's stimulated your immune system. The one from Moderna will likely be available in the community because it does not require the super cold storage that the other one from Pfizer requires. Statistics regarding COVID are sobering. Over 312,000 COVID deaths in the U.S. and 1.6 million deaths worldwide. According to Dr. Bisola Ojikutu, an expert who was on PBS NewsHour on Wednesday, and I would suggest that if you could pull that up on your computer on the web, you look at that, it has lots of great information. She said that she had the following to say: Black, Latinx, and indigenous people are 3 times more likely to be diagnosed with COVID-19, 5 times more likely to be hospitalized, and 2 times more likely to die. And there's no evidence that genetics or biology plays a role. Rather, it is the chronic racism and increased external factors that cause this disparity. 71% of Black Americans say they know someone who was hospitalized or died due to COVID. Well, this is true for only 50% of white Americans. However, even though people of color are more likely to be infected by the virus, there's less of a willingness to receive the vaccine. 61% of all Americans say they will get the vaccine when offered, but only 24% of Black Americans and 34% of the Latino population say they will get it. Although the good news is this number seems to be increasing in both groups in the past few days. There's good reasons for this distrust of our healthcare system. The Tuskegee experiment and Henrietta Lacks cells being used without the permission of her family or anyone really are 2 prominent examples. But I would suggest this is different. Vaccines are the thing that has caused the big jump in life expectancy since the 1940s. Polio, measles, smallpox, and mumps killed millions of children prior to these vaccines. More recently, meningitis, pneumonia vaccines, and the flu shot have decreased the incidence and therefore the death rate of these diseases. Vaccines, much more than the introduction of antibiotics like penicillin and groundbreaking surgical innovations, have had a much bigger effect on the health of the world. The vaccines are going to go to first responders, healthcare workers, teachers, nursing home residents, and staff initially. Then essential workers, people with pre-existing conditions, and those over 65 are next in line. The first few groups are easy to find and will likely receive their vaccines at their place of work. The last three groups will need to be alert for notifications about when they are eligible to receive the vaccine and then get in line. I would encourage you to get it as soon as you can. Even then, you'll still need to wear your mask, at least for the near future. We need to decrease the spread. The sooner we show love to ourselves and others by taking this step, the sooner things can get back to normal. If anybody has any questions about the vaccines, please contact us either directly or through the church office.